Today we have with us eminent IVF specialist Dr. Rita Bakshi, who comes with a distinguished backdrop of AIMS, Lady Hardinge Medical College, and St. Stephen's College. Her work with leading institutes from Singapore, Germany, and Belgium has delineated her worthy experience in the fields of gynecology, obstetrics, laparoscopy, and assisted reproduction. She is proficient in IVF, IUI, ICSI, surrogacy, recurrent miscarriage, endometriosis, and ovulatory disorders and their treatment. During the last 25 years, she has supported more than 4,000 families to conceive through IVF. Dr. Bakshi is also the founder of ADIVA group of hospitals and the founder-chairperson of RISSA IVF fertility clinics. Welcome, Dr. Bakshi. So, Dr. Bakshi, we'll begin with the questions. Yeah. So, according to WHO estimates, the overall prevalence of primary infertility in India is somewhere between 3.9 to 16.8%. What are the reasons for it?
So I think the first and foremost reason that I can think of is female empowerment. The more empowered a woman has become, the more she is, she's rightful of her reproductive choices. So it is in her prerogative now whether she wants to have intercourse, whether she wants to have a baby now or after a year, 2 years. With this right to choice of exercise, she has her career has come to the forefront, and with this her fertility clock has also gone for a toss. So I think first and foremost I would like to emphasize that fertility clocks are not really going to wait. For careers can wait, but fertility is not going to wait for anybody. Secondly, with this I've also seen that the male and female reserves are getting very low. The cause could be anything from lifestyle, sedentary lifestyle, to junk food, to the kind of stresses and the kind of alcohol abuse, tobacco abuse, hookah, laptop kept on the laps. All these are contributory to decreased reserves, both male and female. So because our best reserves are between 21 to 24 years, and it is rare that girls get married at that time. And after 30, the reserves start lowering, and after 35, they rapidly lower. So nowadays, it is normal for 30, 32 years to get married and they take another 3, 4, 5 years to have a baby. Now, with that, the reserves are so low, and people are not really aware about it. For these people, I would only say that if your careers are going to be on the forefront, then always go and cryopreserve your eggs, cryopreserve your reproductive potential, so that you can have a baby later. Now, faulty food also, as I said, contributes in a big way. Increase in sexual diseases, pelvic inflammatory disease, more resort to abortions. So many young people are already having pregnancies and aborted, not probably in the right ways. So they come back with blocked tubes and faulty cycles. So all these are contributing in a big way to increase in infertility.
So, it's not just the career choices which are playing a big role, but it's your wrong lifestyle and also the wrong life choices.
Yes.
Like you said, early conceived,
Early
girls
pregnancies,
conceive
and
early
yes,
pregnancy. Yeah.
absolutely.
Oh,
And with the abortion pills available over the counter, it is so
yeah.
normal for people to just go and take them. And so they already have had so many abortions by the time they reach
Yeah.
us.
So in the long run, it does impact when they want to have a child. Then it does impact their chances of having a child after marriage.
Absolutely.
Yeah. Yeah.
Absolutely.
So you
Absolutely.
just talked about cryo preserving your eggs. So I'll come to that. Uh, See, we have some cases of celebrities having preserving their eggs and then having the child after like 40 years of age. Do you think it's a healthy practice?
So, Dinah Hayden, of course, did it at 30 and then had a baby at 40. Priyanka Chopra just had her baby, and so many of them. who are having their baby that later age. I won't say that this is the best thing that you can do, but yes, it is uh, the next best thing that you can do. See, because if your career is waiting, or if you've not found the right partner at the right age, then it is not fair to be forced into marriage just because our fertility clock is ticking away. So in that case, I would say, like, I do get so many parents, brothers, sisters, all walking together, and they know that she's already 33, 34, has not really found the right person. So they say, okay, why don't you preserve some eggs? At least then we can be at peace. So I always
Yeah.
tell them that don't be complacent. Just because you preserved your eggs also doesn't mean that you're definitely going to have a baby with that. So, but
Yeah.
yes, it's like an insurance policy which you have taken in case you require one day you have that. But that is not just what we would advocate to all. But yes, definitely for people, because I know of so many celebrities who come to me and they're always saying one and only one thing: I wish we were aware. Nobody told us. We thought we are very fit, we are exercising, we are having a healthy lifestyle. We never imagined that our egg reserves are dwindling away. So, they said if we had known, definitely. So, I think we are in an era right now. Apple and Facebook, the MNC companies are already telling their employees to go and preserve eggs, and they are paying for them. So that means they understand that these girls are the ones who are career oriented. They are going to take time to rise up the ladder of success. So then it is right time to go and preserve. So I would say I'm in it for women emancipation and their freedom of thought and freedom of life. In that case, yes, there is absolutely no harm in doing a cycle or two cycles to have at least 15 to 20x cryopreserved and then use them when if required.
Okay, but I would come to the point of the child. Don't you think that having it's not very, it can be emotionally not very entertaining for the baby to have older parents? Uh, like a person like Dinah Hayden had a child at her child would be when she or he is 5 years, she would be 45, and the kids peer group would be having younger
So,
mothers.
yeah,
So don't you think it
yeah.
impacts the psychology of the child from the child's point of view?
So I think, Rajkumarji, we are all living where our lifespan has really increased to 80 plus, and it is not abnormal. At 40, you is the new 30. So I would say that the uterus remains normal, or at least doesn't age to the level our eggs age, and so this is not something for everybody. See, we have to realize that that's what we are here to say, that this we are not advocating for one and all to just freeze and then go and enjoy your life. No, this is for people who are missing the boat in one or the for because of one or the other reason. Then it is not a bad option.
Yeah,
At least they have an option. Otherwise,
yeah,
you have no option whatsoever.
yeah, that's right. So what all facilities are available for infertility treatment in India? Like what do we
So
have right
first,
now?
yeah, so first and foremost, timed intercourse. Now there are a lot of people who cycles are, say, 45 days or 60 days, after every 2 months or 3 months. So they really don't know what is fertility period and what is the right time to have timed intercourse. So by giving them this knowledge that when they should have, when ovulation is occurring, how to keep track of your ovulation and then have intercourse on the right day is the first thing. Secondly, there are a lot of medications that are available for for PCOS, for diabetics, for so you control thyroid, everything before really embarking on this path of fertility, because all this is also affecting fertility. Third are, of course, our procedures, ovulation induction, and then IUI. So in IUI is just right timing your follicle and washing the sample and then putting it in the right place. So that's a very simple procedure. It's like a daycare. These are all daycare procedures, whether it's IVF, even IVF. Yeah, there are no admissions. They are all daycare. Second, of course,
Okay.
is IVF, which has undergone a big change. We have ICSI, we have IMSI, we have so many other things to do an IVF. And
Yeah.
that means in vitro fertilization or test tube baby, where you are creating the baby outside with the egg and the sperm. And then freezing options we've already talked on. Donor options. If you don't have your own eggs, you can take a donor egg. If you don't have
Okay.
your own uterus, till now surrogacy was an allowed option. So you
Yeah.
have, there are so many things which, and we are living in India. We have so many
Yeah.
other therapies available. Ayurveda is here, and we have so many, oil pooling, oil massages, pelvic massages, acupressure, then drinking of oil, purgation through oil, detoxing the body, correcting the hormonal milieu, and then go about. But whether these are all addendas, I would say they are complementary. But seriously speaking, our medical treatment, the allopathy, which has the right treatment, is what I think people should really look at.
Okay. And Dr. Bakshi, in the last 25 years since you have been in the profession, how much of change have you seen in the first in the state of IVF facilities available in India, and also in the mindset of people towards
So,
this?
yeah, so I would say that, we've come a long way. There was slow freezing, and the embryologists used to sit for hours trying to freeze one egg or embryo. Now it's like McDonald's, fast food. You just come, just take the embryo, put it in the container, and it just liquefies in a minute. So, freezing has really, really come of age. Then all our other equipment like IMSI, I can now magnify the sperm 6,000 times. We can look at 6,000 times. I mean, you can imagine a tiny sperm magnified to that level, and we can actually look at it, every single abnormality. uh, so then we have laser hatching. Now we can hatch the embryo. We have time lapse just gives you the, embryology doesn't have to sit there. Every 10 minutes a picture is taken, and you can just come back, look at it. We have one step media. You put it today, and after 5 days, just open. Time lapse has given you all the images. Just open and do the procedure and go. So it has really, every single step, from culture media to creation of embryo to looking at the embryo, everything has taken a sea change in the
Okay.
last nearly 40 years, 50 years. We have come a really long way.
Okay. And what about the mindset of people? Are more people coming forward as compared to the time when you started?
Absolutely. There was a time when people used to hide that they have done an IVF. They would lie, but now you will not believe, Rajkumari. It's everybody very openly says, "Yeah, I did an IVF." In fact, even surrogacy, people are very open about it. Maybe our celebrity stars, our they make a big difference.
Yeah.
If we can copy their dresses, we can always copy whatever that they are doing is also. So I think
Exactly.
with them coming openly out and telling that they have gone through this, that has made a big difference. In fact, I
Yeah.
was on the show with Akshay and Karina on Good
Okay.
News, and I was telling them that, this may be good news for you, but you created confusion for people outside. So he said, no, we understand that, for this is you treat your lab like a temple. But yeah, so we just wanted to make it hilarious. But we got we passed the message that this is there to stay. See, all
Yeah.
couples, like a normal couple, we went for an IVF. So this is all, yes.
Mhm. That's right. Okay. So, and also tell us something about the ART facilities available in India. You've spoken about some of them already.
Yes. So I think India. First of all, I would say why people should come to India. India has got the talent, which is well recognized everywhere. People know whether it is the NHS or anywhere else. It is all Indian doctors who are skilled. We have the equipment. Our success rate is at par with any of the people outside. Our infrastructure is modern. We are not lacking in anything. And more than that, I think is a dedicated care at all times. You can now be available, the doctor is available. I know from people from Canada and other countries, they ring us up and ask because
Mm-hmm.
their own doctors are not available all the time. And of
Mm-hmm.
course, cost is one fourth,
Mm.
which goes without saying. It is value for money. India is such a beautiful place. People want to come here, roam around, see the place, get the best treatment, and then go back successful at a
Yeah.
very small price.
Yeah. So also, do you on your like you have a group of hospitals and fertility clinics? Do you hold like seminars, workshops, or public awareness camps or anything like that to educate people?
So
Just
we
purely
do.
education, normal
Absolutely.
people.
Yes, yes. So we do a lot of CMEs, we do a lot of awareness in the women groups, including the RWA
Okay.
localities, in the corporate offices where these girls are working. And
Okay.
we make them aware of, in fact, we've even done Nukkad Natak.
Acha.
On the street, yeah, we've done
Okay.
street plays to
Yeah.
make people aware so that even the small people around understand what
Huh.
it is. So from our
Yeah.
side, we don't leave any stone unturned. We have the Rotary, the Lions, every platform that we can think of. We try
Yeah.
to make use and make people aware about it. And
Okay.
I don't think it is lacking. At least the awareness, I think, should reach.
Yeah.
And of course, through people like you and YouTube's, yes,
Yeah, that's right. People should be aware. They should be like knowledgeable, and they should know what they are entering into from all
absolutely,
aspects. Right.
absolutely.
One last question, Dr. Bakshi. Ministry of Ayush, like we have this All India Institute of Ayurveda in Setta Vihar in Delhi. So they are doing a lot of. They have that integrated. They've integrated actually Ayurveda system with the modern allopathy. They are doing a lot of works there in different streams like eyes, the treatment of various things. So, is are you in any way associated with them? Like, would you because like you talked about massages and all those things, siddha and Ayurvedic massages. So, do we see any kind of association or collaboration there with them in future?
So, as I said, I think uh, I am proud of India and its culture and heritage and the systems that we have here. My only everything I said is complementary. Massages will help the blood flow better into the uterus. Similarly, the acupressure points will probably activate some of it. But finally, the process itself, the process of creating a baby, which we have done through allopathy, through science, through surgery, getting the egg out, mixing with the sperm, seeing the baby grow in an incubator, and then transplanting it into the uterus. I think it is very, very important that for a little while with small problems, it's not bad to try any of the therapies.
Mm-hmm.
Uh, but if you are not getting relieved, then I think we can't waste time on the therapies till we have to come to the crux of it. We have to do the process itself. So
Yeah.
I would only say that yes, both are complementary.
Uh,
Definitely, it helps. It helps our procedure also. If better blood flows into it, if the lymphatic blockades are all removed, whether it is for sperm or for egg. But I would really ask people to be not totally only on it. बहुत सारे अगर हमारी कंट्री को देखेंगे तो झाड़ फूक तंत्र वंत्र, there's so
exactly.
much of it, you know
Exactly.
so
Exactly.
there are times when I'm looking at people and I'm wondering, why did you waste there so many years? You could have
Uh-huh.
just come. It was easy for me to just look at the egg sperm and make a baby and put inside you. So
Yeah.
I would just say that we need to balance the whole thing. we
Yeah.
can be we can work together, but
Yeah.
we will draw a line as soon as we think that okay, this is not working.
That means the procedure and the process
And the process,
both have to go hand in hand
hand in
for the
hand,
success, and then
absolutely,
the certified qualified professionals, right?
absolutely,
Right.
absolutely,
Okay.
absolutely,
Okay.
absolutely.
Thank you so
So
much, Dr. Bakshi,
most welcome.
for
I would only
sharing.
say that. I would only in the end also say one thing, that
Yeah.
India, is embarked on a career of great success as far as IVF and fertility is concerned. We've seen a huge jump of 16% in the
Hmm.
last 6 years, and
Okay.
there are nearly 30 million couples waiting for this process, and
Okay.
we have only 3,000 clinics working for it. So there's a huge gap. We require many more doctors coming into this field and training and helping people out.
Yeah.
It was
So,
a pleasure, Rajmaiji, to be on this
yeah.
show with
Yeah.
you and create awareness on the topic.
Yeah, yeah. Thank you so much, Dr. Bakshi. Probably we'll be back with you to ask more questions and seek more knowledge from you. Thank you.